So welcome everyone, and thank you for being here for the April 28th session of the Cross Canada Checkup. And today we are talking about the role of physiotherapist assistants and physical rehabilitation therapists in the COVID-19 pandemic. And just before we get started, we're going to go to 2 days a week with these sessions now. So we're going to do the Tuesday night ones that are more this format, and then Thursday night at 7 will be the format where you can unmute yourself and turn your video on and have a really good dialogue. So with that being said, I'm really excited about our two speakers today. We have Sandra Lam and Annie Bélanger, and they're going to be talking to us in a few moments, but I'll pass it over to Mike to get us going here, and then I'll do some introductions.
Thanks, Phil, and welcome everybody. Glad to see so many people and all the names and friends from around the country. Today is really interesting and really special because, as you all know, inside of the Canadian Physiotherapy Association, we don't just have physiotherapists, we have others who are very important as we all move forward. So I just got the numbers here. So it turns out across Canada, we have 120 PTAs, so physical therapy assistants, and 20 PRTs. And so these are some big numbers, and they're very important. And as I look at them, they might be even an underestimation, because we know there's a lot of other folks out there who practice in this field who may not necessarily be members of the association. So you know, today what we're going to talk a little bit about is you know, the role of the team. And in the team, the very important players are the PTAs and the PRTs. And so we have two fantastic guests with us today. And maybe before we kind of go into that, Phil and I have asked them to get ready for a little presentation. But maybe before we even do that, you know, we try to kind of get to know people a little bit before we dive right in. So maybe Sandra, you know, can you tell us a little bit about yourself? And then Annie, we'll go to you, a little bit about yourself in terms of your background and where you practice. And then we'll pass it back over to Phil, and then we'll go right into your presentation. So welcome everybody. And Sandra, please, maybe a few words about you.
Sure, that's fine. Thanks a lot, Mike. I'm Sandra Lam. I work in Vancouver Coastal Health in Vancouver. My title is a rehabilitation assistant, and I practice as a physiotherapist assistant on the spinal cord unit at GF Strong. And I currently sit on the board of directors of CPA as the PTA and the PRT rep. I'm used to the TRP term, but in English it's the PRT, and Annie will speak to that. I volunteered myself as a PTA overseas twice, once in India and once in Bangladesh. And previously I was the PTA rep for the International Health Division for CPA, which is now the Global Health. And I sit on the Rehab Assistant Diploma Program Advisory Committee at Capilano University for about 15 years, and pretty active as I can be in all components of as a physiotherapist assistant around the country. I'm happy to be involved here. And I've also represented PTAs at 2 World Congresses, both in Geneva and also in South Africa. And I'm glad and happy to be a spokesperson. So thanks. Annie, maybe over to you for a moment.
Yes. So Annie, I graduated in Mamahasi College in 2007 already. So I've been a PRT for now 13 years. I've been practicing in public services and also in private practice. And now I work as a coordinator for Service Electrotherapy, which is a company for pain management using electrotherapy. I am still in university perfecting in chronic pain right now and helping throughout the AQP, which is the Quebec kind of division of the CPA. We're partnership with them and representing the PRTs. So I'm quite active also with all the groups concerning the PRTs, making sure that they're well known. And I'm happy to be here to represent them in Canada right now.
Amazing. Thank you so much for the introductions, and really I was going to go through your bios, but I think you both just covered it so well that I'll say a few things and then we'll kind of get going. But I just wanted to thank you for being here and for agreeing to come on. And I just wanted to thank a couple other people. So Jenny Day, who's been coordinating things for the Cross Canada Checkup crew. So with Mike and myself, she's really been taking care of things behind the scenes and coordinating everything. And then Allison and Elisa from the CPA for organizing this as well. And if you're new to these sessions, what we do is we'll have Sandra and Annie go through their talk and their presentation. And then at the end, we want a really good discussion. And Mike and I will be moderating that. So what you can do is you can write your questions in the Q&A. And even as they're coming up throughout the discussion, you can put them up there. And then we'll have a chance to ask them afterwards. And there is a one function on there that you might be using, which is raising your hand. But I think Annie might bring that up a little bit later. All right, so Sandra, I'll pass it on to you. Thank you for being here, and I'll let you get going.
Great, thank you. So I'm going to share my screen here, and just give me a sec to get set up with that. There we go. Are we all okay there? Great. Can you hear me okay? I think I'm not sure if I... Okay, terrific. So thanks everybody for coming. I think this is a really important topic to talk about. We're hearing a lot in the field about physiotherapists. And as we know, part of the team for physiotherapy professionals is also the roles of physiotherapist assistants, as well as the physical rehabilitation assistants in Quebec. So thanks to Annie for joining. We have a fair amount of material to cover. What I'd like to do first, we're talking about the impact of our profession within COVID and our current pandemic. What I'd like to do first, because I know there will be some people on the line in Quebec and elsewhere that may not be as familiar with the roles of the physiotherapist assistant, and outside of Quebec, not necessarily as familiar with the physical rehabilitation therapist. So Annie and I will both be speaking to the roles of ourselves, and also then our impact and what's happening now during COVID. So oh, hang on, I'm just trying to get my screen to move forward. Let's see, there we go. So I will start off a little bit about the lay of the land on just about the physiotherapist assistant profession itself, education, accreditation, and a few resources, and then get right back into the challenges and changes of how things are being impacted now during COVID-19. And then Annie will come. Hers is a little bit more detailed than mine. It's a little more complicated in Quebec. It's quite the situation that's happening there now. And then afterwards, I'll probably ask if we can, I want to make sure we have enough room for Annie to go through her presentation as well. So probably ask, if possible, to hold off on questions until the very end. So write them down in the meantime as we're going through. So I'd like to explain briefly just a little bit of about the education for assistants. As you'll see, this is the Occupational Therapist Assistant and Physiotherapist Assistant Education Program. And the website is otapta.ca. And on here that you'll see, whoops, hold on, I'm gonna go back a slide, sorry. On this that you'll see the OTA and PTA Educational Accreditation Program. It's responsible for the accreditation of the PTA and OTA assistant programs in Canada. And what I've highlighted in blue is just to note that this program for accreditation is governed by both the Physiotherapy Education Accreditation Canada, PIAC, and also the Canadian Association of Occupational Therapy. And it's just important to go through here, and if you go through the website, you can see all the different schools, right? I think it's really good to note. The first program, people are asking about the history of education. The first program that received its candidacy status for education, which is received first before you go through full accreditation. The first program in Canada, so outside of Quebec, that received its candidacy status was in 2011. And the standard now is for a 2-year program for education for the assistants. And currently there are 28 programs in Canada involved with accreditation, of which 24 are accredited and 4 are in the candidacy status to be accredited. There's one program which still remains as a single disciplinary program for PTAs, and it's currently finishing its last cohort of students. And most programs otherwise are dual OTA, PTA, so hence my title, being a rehabilitation assistant. And a few of the programs have either a speech therapy assistant component or a recreational therapist assistant component. And 3 of these programs are offered in French. In comparison to these 28 programs for education for assistants in Canada, in comparison, there are 15 physiotherapist programs. So just looking at the numbers for both. So moving on from education, just to learn a little bit more about the physiotherapist assistants, there is a essential competency profile for physiotherapist assistants. It's put out by the National Physiotherapy Advisory Group. And there's also a competency profile for physiotherapists and occupational therapists. So just take note of that, and you can go to their website as listed below if you wish to learn a little bit more about that. And the NPAG advisory group is a coalition of 4 national physiotherapy related organizations. There's often questions about this. That's the Canadian Alliance of Physiotherapy Regulators, the Canadian Council of Physiotherapy University Programs, the Canadian Physiotherapy Association, and PIAC, the Physiotherapy Education Accreditation. There we go. Okay, moving on. This is related to physiotherapists directly and physiotherapist assistants indirectly. So everybody that's online today who is a physiotherapist will be familiar with their regulator, and I've listed them all for reference. It's really important both for physiotherapists, but also for physiotherapist assistants to be aware of what their college, that physiotherapist regulators state, what the physiotherapist can and cannot assign to assistants. And I'll pull up one specific. So within my province of British Columbia, this is a partial illustration of the standard 18, which is supervision. This is only part of it. And what you'll see is on screen, the physiotherapist is responsible and accountable for the physiotherapy services provided by the personnel working under their supervision. And I brought this slide forward and want to speak to it just briefly because the role of the assistants and the scope and what we're allowed to do in our supervision, it's quite different than the PRTs. And Annie will speak to that, and she'll speak to that a little bit more in detail. Also, in the second part here on the right side, the physiotherapist does not assign the following activities to unregulated healthcare providers and supervisee roles. So the PRTs are licensed in Quebec, just like in America. So Annie will speak to that. So they have a little bit more, they certainly have considerable more scope of practice, and she'll speak to in terms of supervision, what they're allowed to do and not. And just, it's really important for the assistants to realize this, and in as much as for the physiotherapist. So each province has their own, they're fairly similar. It's important just to pass it on in case anyone's not aware of that. And the full website for each one has the full details. I just want to make sure this is only partially illustrated. Okay, and moving on, more the guts and the glory of the presentation here. So challenges and changes during the COVID. I spoke to a number of PTAs from coast to coast and really looking at how our practice is changing and how our climate is changing in these times. And I think there aren't a lot of differences between the PTs and the PTAs and the PRTs, but just wanted to bring some of these issues forward. Certainly, everywhere you go, people are talking about masks and shortages and face shields, and the challenges are. And like I was asking a lot of PTAs, what are your frustrations? What are your benefits? You know, how are things different right now? Certainly, a lot of issues with skin breakdown, no doubt. You know, difficulties breathing, having to wear the masks. A lot of the fear of unknown, and I was hearing this more in Eastern Canada than Western. There's fear everywhere because even the authorities don't have all the answers, and we realize that. But a lot of people are speaking of, you know, they signed up for healthcare to help others and to be involved, but some of the feedback I'm getting is that, you know, we didn't sign up to die. And I hear that more back east than out west, because the reality is there, especially with those that had lived through SARS as well. And it is certainly, we don't have all the information. It was great hearing Dr. Tam today speaking of every 16 days, the amount of cases in Canada are doubling, whereas previously it was every 3 days. So things are improving, but certainly the fear of unknown is causing a lot of anxiety on the workforce. A lot of the PTAs are speaking of excess caseloads, especially in critical care, and many are speaking of insufficient caseloads, especially in acute care, where in some areas, not all, but where they're clearing out beds, making future COVID wards. So a lot of changes and a lot of flux, and a lot of stress from not knowing what's happening, a lot of stress from colleagues, a lot of stress from the patients, hearing a lot in the news. The patients are watching the news, from our families, the patients' families, and even for ourselves. I think we're getting just as many communications at work about how to take care of ourselves and how to keep our stress in check, you know, and to be able to be really there for our colleagues and for our patients. There's been a lot of challenges with some unemployment, I'm hearing, especially obviously in the clinics are closed, in deployment and retraining. That's hard, you know, that's really tough, and that's causing a lot of frustrations, no doubt. Changes of hours and work. And a lot of the units are speaking of now they're working with new therapists coming and having to get reoriented, and just themselves being happy, being the PTA as the consistent staff person. So being the PTA in a team of several therapists is helpful, because you know all the therapist clients, but which is one good thing, but it's just a challenge. New therapists coming and your therapists that you're used to working to moving on to other areas. And communication, a lot of anxiety, and really needing a lot of peer support amongst each other. I think that's a bit of a key in any situation, is really keeping everybody together. And cleaning, if it wasn't good before, it's certainly great now. Everywhere we go, I feel so much healthier at work than when not at work, because everywhere I see, everything is being cleaned so much more extra. And really, people really need to be on the ball about being ready for anything. And Annie will speak to that. Really, being ready for anything we've been addressed that a lot at work. Just get ready to do anything, and it's already happening in Quebec. And I'm really impressed at how the physiotherapy profession has stepped up to the plate. And we're speaking a lot at work about needing to be adaptable and having initiative. And I think it's really important, and I'm seeing that in practice already. And after the challenges, and of course you always have benefits, you know, looking at the glass half full. Of course, improved infection control everywhere we go. And specifically in the areas that I'm hearing from the PTAs, so looking at how beneficial they are and how useful they are in different areas of work. So for example, in critical care and ICU, the PTAs I've asked them, what are you doing more of now? What's changed since the pandemic? And they're speaking of, in critical care and ICU, a lot of two-person proning, as we've heard about. Even more bed mobilization and strengthening, you know, extra ambulation. The assistants are involved in assisted cough and breathing exercises. And in acute care, again, a lot of two-person assist, bed mobility, strengthening really as many attendances, as many times they can see the patient as possible, really helping to decrease their length of stay. The patients don't want to stay, especially in terms of the COVID on site. You know, they want to be home with their families. And it's cost effective having a PT and a PT assistant as opposed to two PTs. In outpatients and community, the PTAs are speaking of also being involved in telehealth, and a lot more than usual. They're speaking of being useful and resourceful in the community and within the facilities, dealing with equipment, both cleaning and resourcing and fixing as much as they can and adapting. And for everybody is this endless teamwork. And I've put in some quotations. There's quite a few here. I put in sort of highlights that I've been hearing from the PTAs across the country. Really, when I first started asking, there was a lot more anxiety, and it sort of ends up being quite with some resilience and hope, both looking at it's nerve-wracking and exhilarating. And a lot of the assistants are feeling that they're more useful now, and that they're really seeing how their teamwork and what they're providing to the team is invaluable. Especially so in critical care in one unit, they started off with 24 ICU and 10 step-down beds, and now they're going to be going up to 80 ICU beds, but it's the one team, the one physiotherapist and one assistant. And so currently at 12 extra ICU beds, they're working hard, and the team is really seeing their value for sure. And a lot of the assistants were talking about their sense of humor, and how I've asked them how they're coping and how they're managing that. And I like this one. I still maintain my positive attitude through the madness. And the assistants are just really talking about, oh, I've got you. Sorry, I didn't mean to get that. Not yet. Sorry, Addie. Really feeling useful, especially with the patients not having their families there. They're giving as many interventions as they can, as many tasks they can do on behalf of the physiotherapist. And in the end, what I'm reading resilience, and I'm reading teamwork, and less fear than in the very beginning. I think it's getting easier, and the physiotherapist assistants are really feeling that they're feeling like the glue that holds the team together a little bit, right? They're trying to be there as much as they can, and it's getting better. It's getting better for sure. And I think there's challenges, and I think everybody needs to work together and support each other. And I don't imagine it's too different for the physiotherapist or the PRTs. So I just want to give you a bit of a recap of the profession for the physiotherapist assistants. And the story in Quebec is quite detailed and quite long. So my presentation is going to be a little bit shorter than Annie's. And I'm just going to transition over to her. And I want to make sure we have enough time for questions and answers at the end. But thank you for being there for us. And Annie, I'll stop sharing here so then you can transition over to your presentation.
Let's share my screen. Cool. And everything's in order. I just want to make sure. Perfect. So hi everybody. I want to check how I can do this I'd like to know from raising hand. There's a little button that you can raise your hand. And I don't know if Phil can tell me the numbers afterwards because I can't see it right now. Who is from outside of Quebec and does not know much about PRTs? If you can click on the button, and I can adapt my speech according to that as well.
Right now we're at 70.
70. So
Over 70.
Over 70.
Yeah.
So I'm going to introduce basically so you guys can know what a PRT is in Quebec and our application in Quebec and the COVID crisis right now. Because the situation is quite different, and also our job is quite different as the PTAs. So I'm going to go through here. So I'm going to introduce the physical rehabilitation therapists to understand the difference between the PRTs and the PTAs in Canada. What are the roles right now of the PRTs in the context of the current crisis? And I'm going to speak mostly about the public healthcare system right now. And what could be the different interventions that we could do in the context of crisis concerning the hot zone, the warm zone, and the cold zones. So hot zone, I don't know if it's like this in the rest of Canada, being COVID positive, warm zone being maybe positive, maybe not, and cold zone, no cases of COVID. And let's start with the biggest slide I have. You can see it looks quite complicated through here. This is pretty much the regulation and the approach we have to take before taking in charge a patient in physiotherapy. The PRT is licensed in Quebec as a physiotherapy professional under the OPPQ, which is the Order for Physiotherapy in Quebec. We have a 3-year diploma program offered by Quebec colleges. And in daily practice, PRTs work with patients of all ages who have various conditions. In order to treat patients, we have a code of ethics of physiotherapists and physical rehabilitation therapists that requires that patient first be assessed by a physiotherapist or a physician, which is different than PTAs. So, and we need to have a diagnosis not restricted to the symptoms. And right now, in the cases of the COVID, the OPPQ has softened the rules for the category 1 over here. So I'm going to talk a bit about them, but not too much because it's kind of hard to understand in 20 minutes. This means basically that the physiotherapist or the physician determines the problem, and the PRT will contribute to documenting and identify problems depending on the impairment of the patient. We can also, according to the Article 39.4, intervene in prevention without prerequisites, depending on the intervention. And I'm going to go through a few examples in the COVID cases. So basically, PRTs, following all applicable rules and procedures, can take on full care of patients in physiotherapy. Our main goal is to help them regain function and get back to the activities of daily living as soon as possible. In contrast, in comparison to PTs, the PTs are able to assess patients themselves and can do so without a medical referral. PRTs, will do so with the physician or coming with the physiotherapist as a partnership. So instead of going through all the categories over here, I'm gonna just lead some examples of what category is a patient that we can treat. And then I'm gonna tell you the independence level that we have through them. So category 1 is basically where we have a lot of independence. A patient that's stable, who suffers from impairment, which establishes loss of autonomy, and needs to maintain a level of autonomy or recover functional autonomy. So in the context of COVID-19, definitely it's all our elderlies. And that's why the OPPQ has softened the rules so we can take care of them, prevent from deconditioning, and make sure they are safe. In category 2, we're looking into patients with an orthopedic or rheumatic disorder that does not interfere with normal growth. Category 3 will be with the youth for orthopedic and rheumatic disorder. Intensive period of neurological disorders for functional rehabilitation. Chronic COPD controlled. Peripheral vascular disorder. Skin disorders except for the grade burns. Geriatric profile, the condition which requires an investigation. And if I did not mention anything in here, it's in the category 4. So I'm gonna try to make it as simple as possible for you guys in the next slide over here. So to make it simple, if we fit in the category 1 to maintain a functional or optimized functional capacities, it will be a high independence level. We're gonna need a diagnosis, and then afterwards we can do a collect evaluative data. It's basically our terms for assessment, which is kind of reserved for the physiotherapist. But we can analyze and create a list of problem objectives, precautions, contraindications, and determine the treatment approach, provide the treatment, and reassess, modify the treatment through that. So we have a full independence on this side, working with the physician. In the category 2, we're going to need more of a diagnosis to list the problem objectives or objectives for the treatment. Then we can complete the assessment with a collection of evaluative data and if we find a new problem, that's where we're going to work in partnership with the physician or the physiotherapist to work through that problem. But we can always modify the problem objectives and treatment approach. Then our independence starts to actually be shortened, and we work more in partnership with the physiotherapist or the physician. In that case, the physician needs to fill quite a few things: the diagnosis, the list of problem, objectives, contraindication, precaution. As you can see, it's quite exhaustive. So we're going to work mainly with a physiotherapist and their assessment in that case. But we're still able to make decisions with them regarding the mean of treatment and apply the treatment. And then our category 4 will be applying a treatment approach prescribed by the physiotherapist or the physician. So that's where I would put the PTAs if we look in the comparisons of the categories, if it gives you an idea. So in the other categories, we're able to actually use or analyze and change things through the treatments. But in category 4, we're going to apply and work in partnership with the physiotherapist. And now I'm going to talk about the COVID. So I hope it wasn't too long about talking about the PRTs. I know a few of you don't know all the rules, but now in Quebec, you know the situation. You've probably seen the news on social media as well. We have a lot more positive cases, and unfortunately, it's our elderlies that are affected, creating in the elderly homes staff problem. The staff is being infected, forced to stay home in quarantine, and having a rotation of staff and missing staff, and everyone being overwhelmed. Basically, we're running out of staff in their elderly homes and the public healthcare system. The PTs and the TRPs working in private practice have offered their help to support our healthcare system. And unfortunately, we weren't called in right away. Specialists, the Army came over, other professions were called in before us, and AQP, CPA, and the OPPQ worked together to help this move in order to be heard. So I'm going to tell you the actions we took, and we got great results, but our situation was quite frustrating as for physiotherapists and PRTs not be able to go on the field. In Quebec, we have different zones. We have the cold zones where there's no COVID cases on. We're going to work mostly as PRTs in prevention and doing our regular task, of course, making sure that we're safe and we're doing all the disinfection through that. Warm zone, still again doing prevention, and I'm going to go in more into details towards that. Some of the PRTs will be doing their PRT tasks, but they will also be working as care aid, feeding or helping out the nursing team because people are starting to get overwhelmed. And in the hot zone, so far, I haven't heard any, and I hope one day it's going to change, PTs or PRTs that are not working as care aid. Everyone so far, we're missing care aid in the nursing homes. So right now, that's what we are doing. We're ready for anything helping out the staff. So that's the situation in Quebec, and I want to let you know that as the Association Québécoise de la Physiothérapie has done a lot of things in partnership with the OPPQ and CPA. So we've created a questionnaire in order to draw up a list of physiotherapy professionals available to contribute to public healthcare system. It was submitted, and we've had answers, and we're starting to have physiotherapists coming in, and also PRTs. We went on the newspapers and did some interviews with our president, Simon. And just a quick cliche of how the PRTs are not as well known, even in Quebec. As you can see the titles, you see physiotherapist that is disappointed, although we were mentioned in the article. So we're not as known in Quebec as well. We're always referred as physiotherapists on our side too, so we have to show what we can do. And I think Simon did a great job at it. We did testimonials coming from our members, PTs and PRTs in private practice and public practice as well, to show what we're doing during this crisis to be able to treat our patient and keep on going. This partnership with CPA has been great and solid, having those webinars, and thank you again, during our presentation. And we did a letter to the Prime Minister saying how shocking it is right now that the physiotherapists and the PRTs are not yet on the field. We also developed a tool for managers to help them understand the field of competence in physiotherapy and allow them to facilitate the integration of the new physiotherapists or PRTs in the establishment in the context of crisis. And we're also working right now with the Private Practice Federation to offer a guide for PPE suppliers, which is also a problem right now, having all the gear because we have a lot of cases. So I'm going to switch right now to what could be done by the PRTs to increase the efficiency in the healthcare system. As I mentioned before, we're doing a lot of care aid right now, and we're trying to do what we can. And if we have a great organization, and if the managers can find a way to organize the system, these are the recommendations I would give to them to help the patient benefit the physiotherapy services. So prevention, 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 I think it's the key word, especially in our cold zone. I've done a survey on SurveyMonkey, asking the PRTs what they were doing right now, and a few things came out and great ideas came out as well. So in the cold zone, we want to make sure prevention calls telehealth to all the seniors staying at home or going back home from rehabilitation. Make sure they have instruction of precautions, social distancing, hand washing, their health investigation. They're stuck at home and they don't have much service. Are they getting enough food? Are they at risk of fall or deconditioning? Do we have to intervene to help them and give them a general exercise program to prevent from deconditioning? In hospital or elderly residents, I do think we need to do some verification for patient deconditioning and give them general exercise programs in order to prevent from further deconditioning through the social distancing. Verify their transfers, their walking, their risk of fall to prevent injuries, prevent having them going to the emergency or deconditioning. Also through this crisis, we can verify psychosocial needs and refer to the through professionals that could help them or through family. And taking action in coding system in prevention if the unit becomes a warm or hot zone. Giving cues to the staff that's going to come and help out because the staff is coming in and out, and basically sometimes we don't know if the patient can be transferred or if it's eVisol ever. So if we're doing a great coding system, we can help out the nursing staff, we can help out the patient from preventing falls, preventing disasters. And guide the nursing staff as well from safe mobilization. In Quebec, we have a course called PTSB, and often the PRTs are teachers. And we're basically showing how to do safe mobilizations for the staff. And I think it would be great to integrate into a training for all the new aid that's coming from the external sources. I'm gonna switch next one. In the warm or the hot zone, again, I'm going to say this, all the prevention is according to the Article 39.4, so we don't need to have a referral for this. It's acting on spot, referring to and preventing a bad condition. We can help the nursing staff right now, and I've read into articles and through some also PRTs that spoke with me. Sometimes we have one nurse for 50 to 100 residents. So taking the vital signs is quite difficult for them. It's something that the PTs or the PRTs could do to help the nursing staff from having problems. So BP, respiratory rate, heart rate, saturation, and auscultation. If the PRT feels comfortable, it's something that we've seen in the college, but sometimes it's kind of far. So if you have the proper training, check for bed sores, source of deconditioning as well. We don't want it to have add-on bed sores through that. And a lot of residents sometimes don't even have time to hydrate or can't hydrate without help. So checking the hydration for the patient. Again, in the warmer hot zone, patient deconditioning is crucial to verify. Their transfers can change, their walking and risk of fall can change at any time, but we need to keep them active if they can. And the entrance sitting to facilitate feeding and hydration as well. guiding the nursing staff, again, in safe mobilization maneuvers in bed. Like I said, a few are doing nursing aid and care aid, so in exceptional measures that could be done as well. Cardiorespiratory. So in the cold zones, that's where we're going to work the most. Again, in prevention, helping the staff. I'm not going to go through that again, but if we go from category 4, working with the physios and the physician, we can do treatment application after the COVID phase for acute cardiorespiratory conditions. We can also do it after the acute period when the patient is controlled, and then keeping them active and functional in category 1 afterwards. So the evolution is going to change depending on the impairment of the patient and the reason of consultation. In the warm zone, again, prevention, but category 4, we can do treatments with the patients, and we can do, I was asked by Sandra if we were able to suction. We are able to, but we cannot go beyond the pharynx, which is a reserved act by physiotherapists in Quebec. We cannot as well adjust the oxygen. I was asked by a few PRTs with the prescription or without the prescription. It's an, again, reserved act for the physiotherapist. But you can work with the physiotherapist on that side. And in category 3, if the COPD is controlled and you want to keep the treatment active in prevention that he gets sicker, we can work with category 3 as well. Deconditioning, which is our biggest concern, I'm thinking, with all the patients. In the cold zone, we're respecting basically with the social distanciation, telehealth, and if we have to do emergency treatment or regular treatment in the elderly houses, we can do a regular treatment if we feel we need to do it. But I do recommend having a functional portrait of the patients and giving them a general exercise program to keep the resident moving and active and avoid deconditioning due to social distancing. In the warm zone, it's the war zone. So I put the patient in the middle and everybody working together as using what we can do. So if we're able to do vital signs, help the nurse. If we can help the PABs, which is our care aid, help the PABs, helping them prevent injuries as well, making our patient active, even if they're in the warm zone, if they can get up, having them get up so they don't decondition for the after COVID, because we know it's going to be hard for them as well. Support the family, hydrate them, and of course, check the skin integrity. And if we have to, then bed mobilization to prevent deconditioning, and of course, work the skin issue treatments. So I'm going to finish in conclusion saying that in this COVID-19 phase, we have to work in partnership with all the health professionals, but we have to use the professionals in the right moments to optimize patient care during crisis. And the interdisciplinarity and partnership with the physiotherapist and the PRTs will be so important, and it's going to optimize patient and physiotherapy. So it's a big let's work together. And I am pretty much done, Phil. I'm ready for Q&A.
Thank you. Yeah, thank you so much, both of you, for your presentations and for talking about it. And such an important topic, and really the link and the collaboration between all healthcare providers and PRTs and physiotherapist assistants are so essential all the time, and especially now. And I really like that point at the end where you said we have to think about using the right professionals in the right moment, like in the right places. And really it's about like optimizing what we can all do and the resources that we have, because we do have a lot of healthcare professionals, but it's a matter of figuring out what is unique to that profession where they can be allocated. So I really like how you brought that up. So if you do have any questions, then you can type them in.
I'll read off the first one here. So the first, and thank you again to Sandra and Annie. Amazing. Love what you had to say. A great amount of detail and sort of very convincing. So Our first question comes from Sean Cleaver. This is for you, Annie. Some training for new workers in CHSLDs around infection control is being given by video. Has there been any discussion of physio professionals contributing to training modules for body mechanics and transfer? So I guess that's from Sean.
Hold on, I'm just going to recheck the question. Has there been any discussion of physio professionals contributing to training modules for body mechanics and transfers? Yes, it's a course which is called the PTSB. This is usually given in CHSLD, and right now I think we have to move everybody in the field quickly, and it's something that should be considered even before putting new staff on board. So giving them that body mechanics and transfers before going on. Of course it should be done. I'm not sure it has been done everywhere because they want the staff to go right away. I don't know if that answers your question, Sean.
Well, thank you, Annie. Sean, if you want to add, oh, he said it's not happening now. So, I think Sean brings up a good point. And Phil and I and many others on this call have been talking about this, but the worst time to I'm going to sound like a broken record, but we'll get it one day. But the worst time to plan for a disaster is in the middle of it. And so, we're not going to be able to catch up. So the only now use the let's not let a good crisis go to waste. So how do we use now to prepare for the future? But as there's more questions coming in, let me ask the two. Well, maybe Annie, maybe you. When the military was called in to provide support at some of the facilities in Quebec, did that push away the PRTs? It's like push away so the military in, or was everyone working together? It seems to me that there was plenty of capacity already in Quebec that could have been mobilized fairly quickly.
Yeah, I don't think it pushed the current professionals that are working in the public system. I think it pushed the one that were waiting to be on, that were on the list waiting to go on, helping in the public system. And those transfers we're talking about and mobilization would be great to have those staff on board. So we had to push to have the PTs and the PRTs coming in after the Army came in, at our great surprise before even us.
Well, thank you. And Phil, can you watch the chat there? I think Andrea has something to maybe comment. But before we go there, I would like to underscore something, Annie, you said, which there is a very good example when you have a regulator, right, in Quebec, the LOT, OPDQ, and then the AQP, the association, and the national body, the CPA, working together to push something forward. So let's put that on the agenda. There's an example of kind of how things may not have been perfect and all that, but it was an example of mobilizing quickly to make something happen. And I will put a little down to this. Amazing what Simon has been doing at AQP. I think he's really been something very important to watch into the future. So that's just a couple points. Phil, do you want to read some of the comments or?
Yeah. So on that, there was a message from Andrea Brody who says, I work in the West Island of Montreal, and we have a 3-hour training, including PPE and PDSB, for all those coming to help and are the ones training the military. So that was just a comment on that.
Thank you.
So we'll go to another question here. So Diana Hopkins-Rossile had a question. So can the patient titrate their own oxygen in the presence of the PRT after consulting another professional, such as a PT?
They can, if they're able to change their oxygen on their own, and they can do it as long as they respect the prescription according to it. But the PRT cannot change it, but the patient can.
Okay, great. Thank you.
That's cool.
Yeah.
I hope so.
Right.
All right. So Mike, do you want to?
Yeah, Loren Aubry-Roy asks, how can I motivate my boss to let me work in the hot zone and help the residents at my CHSLD to not lose the capacity? So how maybe for the two of you, maybe Loren is a therapy, or so how do you motivate? Because how do you motivate the system to kind of push and allow and support and advocate for TRPs to be more involved, maybe specifically in Quebec?
Well, I think it's proving the points of the after COVID. If you see that residents can recover, because it's not all the others that actually don't recover, but the impact on the deconditioning and the impact of life of the patient afterwards. That could be a great recommendation to prove what's the impact of you not being there for mobilization, prevention, helping on that zone. And we're going to try to give some recommendations according to, again, the category of impairment, according to the zones, like I put in my PowerPoint. So maybe that could be something helpful for you to present.
That would be a good thing to share. I think I saw at one point CPA had something around, or maybe it was WCPT, around how do I convince my boss, and I don't like that kind of concept, but how do I convince maybe somebody who controls the finances to allow somebody to go to WCPT? And there was like some examples of like some arguments because a PT or PT.
Well, it's kind of, we have to prove the point of what's the impact of us being there as well. Are we going to be able to support the kid or nursing aid as well? Do we have job to do in prevention in the cold zone with patients that need our help as well? I think it's to see the ups and downs and to be able to prove that to the manager.
Gayla Dial Dion asks, what training has been offered for infection precautions specific to this current pandemic and previous during your education? So maybe Sandra, you want to start that, like from the PTA perspective, kind of what kind of training in infection?
Sure, there's both. There's training both in our work sites, certainly through my health authorities. I've seen a number in our in-services, and as well within the schools, there are components in there in terms of infection control, and there has to be, for all obvious reasons, especially now. So there definitely is training for infection control, absolutely. And I'll just touch on a previous question I see through here. Sean was responding to Annie with regards to physio professionals contributing to training models for body mechanics. I know at least here in BC, and as well I believe the PRTs are as well here in BC and in the Fraser Health Authority, there were some PTAs that were helping in the training of other staff, like nursing staff, in terms of proper body mechanics and transfers. So their PTAs are being used for that, as well as the PRTs in Quebec.
Annie, from a TRP perspective, would you agree with what Sandra just said? Kind of,
yeah.
Yeah.
I think the training will be offered joining the establishment. I think it's a prerequisite. And for the transfers and mobilization, it's pretty much the PRT's expertise in elderly houses to train the staff, usually, or to make sure that there's no incidents with the residents. So yeah, I would have to agree with Sandra.
Okay, great. Thanks for answering that one. And if anyone has any, when we ask a question, if anyone has any comments on it as well, you can you write your comments in the comment box and we'll read them out too. I can tell that there are quite a few students with us today. So now I'll get to another question here from Paris Nguyen, who says, when you talked about prevention in the cold zones, is it only in the hospital? I'm working in Ontario and in long-term care retirement homes. The college only allows emergency care, not prevention of deconditioning.
Right now, we can assess any patients in a cold zone and check for prevention of deconditioning with a patient in community or in elderly care services. So it's not a problem for us in the cold zones for prevention.
Okay, so it's in the community as well as long-term
Yeah.
care. Yeah.
We'll call our patients. We'll make sure that they're fine, they're not deconditioning. As long as we're not giving specific exercise for, let's say, a hip problem, then if we give a general exercise for them to keep for being active, then it's not a problem, it's prevention.
Okay, great. Is that the same perspective and experience that you have, Sandra?
Let me just reread the question when you talked
Some
about
of the prevention, so the role of the PTA being kind of in hospital as well as in long-term care and in the community?
Yeah, absolutely. Talking about prevention, the more, you know, our goal, our primary, one of our primary benefits across all areas are, you know, increased strengthening, that decrease the days and be home sooner, you know, absolutely, you know, for sure, getting them stronger, faster. And that sort of leads into Vivi's question. I can see, do you anticipate that the role of the PTA, PRT will evolve or change as a result of the pandemic? I think our roles are showing their virtue. And I understand, fair enough, that in all healthcare professions where you have assistants, sometimes there's some power struggles. Maybe some therapists are concerned of our roles are evolving too much, but I think at the end of the day, especially in any kind of disaster, you know, any kind of emergency situation, you need to use the full capacity, the full scope of all professionals that are available to do what's best for the patient. You have to do what's best for the patient and the healthcare system, and, you know, not to have anyone that's feeling a little protectionist. You know, I've seen that with the nurses, in various disciplines. I think it's only common sense, and it's very cost effective, and we need to do what's best for everybody. And I think that's really important. And we're really seeing that in Quebec. Absolutely.
Sandra, I'll completely agree with you. And certainly a few weeks ago when Alice Aiken came on,
Mm-hmm.
she said exactly that too, and which is like, let's not look internally, but we've got to put the health of Canadians before any of our arguments, you know, just full stop. And I'm coming with a question, but I'll also say, I for one, and I'll usually speak for Phil too sometimes, and he speaks for me, we're not concerned with the movement of advancing PT assistant scopes of practice, not at all. In fact, if we all work to our maximum of scope, then we have a shot at making some change. But if we're all navel gazing too long, you know, that's not going to work very well. So I just want to say that publicly among everybody here. But here's the question. We've talked a lot about telehealth and telerehab in this post period. What, I'll just be blunt, can and what role could a TRP or a PT assistant play in this new world?
Sure, maybe Annie, I'll start, and you can your scope may be a little bit larger. There are some PTAs that are offering telehealth across the board that I've seen and I've heard from as well. And Annie, you can collaborate as well, but continuing, especially being in the homes of the elderly and those that are at home, community care, they're definitely there, helping them with their exercise programs, keeping them motivated, make sure their techniques are safe. And I think the more we can provide, the better overall. And I think, Annie, you're seeing that the same in Quebec as well.
Yeah, we're seeing it in public health, especially in community, because in residence care, we're still there. And in private practice, it's been used massively with our clinics. It's considered the treatment right now. And if we have to see an emergency, we will see an emergency. But right now, telehealth is the way to go. It prevents from having the patients not doing his exercise properly. We can upgrade the exercise program as well, and we can make sure the patient is doing well mentally as well, because we know it has an impact on the pain. We know it has impact on a few things. So telehealth for us has been quite useful.
So all those categories in the role that you described can happen online as well as in person. Yeah. Yeah,
they will apply the same thing in telehealth. If the patient has been assessed by the physiotherapist, I can be working with the patient in telehealth without a problem.
Okay. We're getting kind of to the time, but we haven't followed up on these questions coming left and right, but I think this is an interesting one here. So this is from Amanda de Chastelain, who's on the board. Annie, in Quebec, then, are PRTs seeing all patients that are on the wards to prevent deconditioning, or do you have to get a physician or a PT referral to do so?
Again, if it's prevention and it's general exercise, we could see, I say we could see, but we don't see everybody because we're missing staff for that. Ideally, patients should get exercises to prevent deconditioning, like they were getting for general exercise class, let's say. But if we need a PT or a physician prescription, is only if we want to work something specifically and to increase the capacities.
Thank you. Phil, take us home.
All right, thanks to both you, Sandra and Annie, for coming on and speaking with us. There are a ton of questions here from students, but unfortunately we're not going to be able to get to them all. But I will say that Annie has agreed to come on to do a French version of the Cross Canada Checkup. So we'll keep you updated on that. And just before we go, our next session will be Thursday, but then the next one with the CPA is going to be with the Indigenous Health subgroup of the Global Health Division. And they're going to be talking about the impact of COVID-19 in rural areas and Indigenous communities. But I'll just wrap it up there. So I just want to say thank you, Sandra and Annie, for coming on and speaking with us. And I know that I learned a lot, and I know that I'm sure everyone here learned a lot as well. So thanks a lot.
Thanks, everyone.
Everyone.
Okay, have a good night, everyone.
Have a good night.